If you need some help at home with an elderly loved one, Alta Home Care may be the way to go.
Their focus is to keep their clients on a high level of independence. Here to join us is Janet Kim. Hello,
Hi.
Janet, from Alta Home Care, right?
Correct.
This care is for the elderly, right,
Yes,
Janet?
that is.
All right. So for our viewers at home, what is the difference between home care and nursing home care?
So it's completely different. So home care is primarily for ADL, so basic activities of daily living.
Right.
Versus a home health would be more medical. So we're not a medical company, so we can provide care such as bathing, dressing, grooming, even companionship. Some
Right.
elderly clients just want that companionship, or they're alone, or their kids are scared to have mom or dad left alone.
Mm-hmm.
So we provide that services. Versus home health, like a skilled facility, or having a nurse on home, it's definitely more medical. They would work with the G-tubes, trachs, things like that.
Tell me more about your background and your position with the company.
So I'm a licensed nurse. So what I do with Alta Home Care, I'm the case manager. So we kind of go above and beyond home care. We normally just have caregivers in our client's home. But with the nurse on hand, we do nursing oversight visits. So I visit majority of our clients. So a lot of driving, visiting our clients, do a lot of wellness checks. And so a lot of them don't know that they need help. So that's kind of where I come in, and if they need help, then I refer them out to physical therapists, occupational therapists, and also the nursing, just like you said. So I also refer out to home health if they need more help, more than non-medical.
Do you ever come across situations where you actually have to get APS involved, adult protective services?
Fortunately, yes. I've unfortunately had, I think I've been in 5 cases since I've been working with Alta with APS, unfortunately. But that's something definitely our caregivers are trained to notify us ASAP if something like that is happening. And then of course we have to involve APS because we're here to advocate for our elderly clients.
As a nurse, what is the difference between working for a home care as opposed to a nursing home or a hospital in that matter?
It's completely different. I absolutely love home care because it's more one-on-one. My clients know me. I've been here for about almost 3 years. I walk in the door and it's a relationship. Versus when I did work in the hospital at one point, they're in and out. I see them, I don't see them again, you know? But that's what I love about home care so much because I can really build a relationship with all our clients.
Yeah, so also there's a difference between home care and home health.
Correct.
And so you mentioned that you're non-medical and so forth. Can you explain a little bit about what home health is? Because I think people get those words confused a lot too.
Yeah, so we're not a home health company, but for home health, it's completely different where that's normally a doctor would have to give you a prescription for home health, and that's normally when you're discharged from the hospital. Then that's when you have nursing visits along with physical therapists, occupational therapists, speech therapists, the whole 9 yards of what you may need. Completely different from home care, which is basic ADLs, non-medical related.
Wonderful. Now where is your office?
Our main office is located in Corona, but we cover a region all the way out from San Bernardino Valley, all the way out to the high desert, South County, so our territory is huge. So although our office is in Corona, that doesn't mean we don't service pretty much everywhere.
How about the biggest challenges you might have with what you're doing?
The biggest challenge I would definitely say is what you mentioned earlier is APS. When I
Adult protective services.
Exactly,
Clear that
adult
up,
protection
yeah.
services. When I see that our clients are being neglected,
Right.
or they're not getting the proper help that they need, and a lot of the times when I give them that recommendation, they refuse it. Just last week, it was their high recommendation to get more additional help. You know, he was declining significantly, and the doctor and I even spoke, and we were both on board, and the family declined help. So things like that's hard for me because then I know he's having more of a difficult life than he can really do
So it's
better
the
if
family
he
that's
listens.
saying no to this help that's being offered.
Both family and client. Yeah.
Right. And
Client,
sometimes it's a hard balance to decide if they're really self-neglecting or
Exactly.
and we don't know sometimes what will wind up coming up around the path with that if they go to the hospital or if they are okay on their own.
Exactly.
Yeah.
What are the usual issues? Why would they say no to these services if they're provided for?
Well, they do pay for them. So,
Exactly.
yeah.
That's exactly what it is.
Yeah.
They do pay for it. So I would highly recommend, let's say, 24-hour care because he had an episode where he was stuck in his chair all night long and just sat there because he couldn't get up because of severe
Right.
weakness and waited for our caregiver to arrive at 8 a.m. So that's unacceptable. However, just like you mentioned, that means he would have to pay for the additional care at night.
Right.
And the
sometimes
family's like,
people
we don't
can't-
want to do
and
that.
sometimes they can't afford it too. So those are very
It's very
difficult
expensive, right?
Absolutely.
circumstances. Yeah, and so
What are the ages of the that?
Oh, they vary. Elderly, it could start anywhere because even they can be young as maybe 40. Because even rehab discharge to the eldest patient I've worked with was 103.
wonderful.
So
Okay,
very big gap. So.
that's fantastic. How would people at home be able to get in touch with Alta Home
Oh,
Care?
absolutely. You can definitely go to our website. It's very easy, self-explanatory. You can go to www.altahomecare.com.
Okay.
Or if it's easier, you can call the 1-800 number we have. It's a toll-free number at 1-800-399-9854.
Wonderful.
That's great.
Yeah.
Thank you so much.
Thank you.
Well, if you're ready for a dance lesson, we are going to be dancing here in the studio.
The lovely Arlene Santos is going to be teaching us a little bit of salsa later on. Are you ready, Mary?
I am.